Three-dimensional planning has transformed orthognathic surgery, enabling more precise diagnoses and predictable results. Unlike conventional methods based on two-dimensional cephalometry, three-dimensional technology integrates CBCT images, intraoral scans, and clinical photographs to generate a complete representation of the patient. This allows for the accurate analysis of bone, dental, and soft tissue relationships in all three planes of space. The process begins with the fusion of different digital records, creating a virtual model that simulates the surgical outcome before the procedure. This simulation allows for the planning of bone movements, verification of the final occlusion, and anticipation of aesthetic changes. Furthermore, it facilitates the fabrication of surgical splints using 3D printing, which improves intraoperative precision and reduces surgical time. Among the advantages of the digital environment are the ability to evaluate different treatment alternatives, optimize the airway, and anticipate residual asymmetries. Additionally, facial visualization facilitates communication with the patient and collaborative work between the orthodontist and surgeon. 3D planning does not replace clinical judgment, but it complements it with high-precision tools. When properly integrated into the treatment protocol, it improves the quality of care, minimizes complications, and contributes to achieving more stable functional and aesthetic results.